What nicotine does to your brain. Nicotine mimics several neurotransmitters, which send signals in the brain. Since nicotine is similar in shape to the neurotransmitter acetylcholine, signaling increases in the brain. Nicotine also activates dopamine signals, creating a pleasurable sensation. Over time, the brain begins to compensate for the increased signaling activity by reducing the number of acetylcholine receptors. This causes a nicotine tolerance, so continued and more nicotine is needed. Nicotine also stimulates the pleasure centers of the brain, mimicking dopamine, so your brain starts to associate nicotine use with feeling good. According to the National Institutes of Health, the nicotine in cigarettes changes your brain, which leads to withdrawal symptoms when you try to quit. When this happens, you may experience a variety of side effects including anxiety, irritability, and a strong craving for nicotine. The changes that occur in the brain as a result of this cycle creates a dependence on nicotine, because your body is used to having the nicotine in your system, which then becomes an addiction that can be difficult to break. Here are the most common side effects of nicotine and smoking on the brain. Cognitive decline, increased risk of dementia, loss of brain volume, higher risk of stroke, and higher risk of cancer. Cognitive decline typically happens naturally as you get older. You may become more forgetful or not be able to think as quickly as you did when you were younger. But if you smoke, you may experience faster cognitive decline than non-smokers. This is more serious for men according to the Whitehall 2 cohort study. It examined the cognitive data of more than 7,000 men and women over a 12-year period. The researchers found that middle-aged male smokers experience more rapid cognitive decline than non-smokers or female smokers. Smokers also have an increased risk of dementia, a condition that can affect memory, thinking abilities, language skills, judgment, and behavior. It may also cause personality changes. A 2015 PLOS-1 study looked at 37 studies comparing smokers and non-smokers and found that smokers were 30% more likely to develop dementia. The review also found that quitting smoking decreases the risk of dementia to that of a non-smoker. Loss of brain volume. According to a 2017 drug and alcohol dependence study, the longer you smoke, the higher your risk of greater age-related brain volume loss. Researchers found that smoking negatively affects the structural integrity of subcortical brain regions. They also found that smokers had greater amount of age-related brain volume loss in several areas of the brain, compared to non-smokers. Smokers are more likely to suffer from a stroke than non-smokers. According to a Centers for Disease Control and Prevention study, smoking increases the risk of a stroke by 2 to 4 times in both men and women. The risk increases if you smoke a higher number of cigarettes. The good news is that within 5 years of quitting, your risk may decrease to that of a non-smoker. Higher risk of cancer. Smoking introduces many toxic chemicals into the brain and body, some of which have the ability to cause cancer. Dr. Harshal Karain, the medical director of Wellbridge Addiction Treatment and Research, explained that with a repeated exposure to tobacco, genetic changes in the lungs, throat, or brain may increase your risk of developing cancer. After knowing what nicotine does to our brain and some common side effects of nicotine, just don't smoke. I hope this video helps you understand why we should not smoke.